Hey everybody, what's up? Make sure everything looks good. Look a little bright there. I'm in the window, or next to the window. Well, that works. I look like an acupuncture angel. All right, hey everybody, how's it going? So we've had some super duper exciting changes in Eastern medicine in this last month. And I learned these from Marilyn Allen and Sam Collins, who both work for the American Acupuncture Council, and they're both really highly involved with the politics of Eastern medicine and acupuncture and with the World Health Organization. So I love getting the lowdown from them, and there's some awesome things that are happening that I'm going to go over right now, and then if you have any questions about it, then we can discuss that. So the first thing that happened in this last month is the World Health Organization. I'm looking at my notepad here. The World Health Organization changed the name of TCM, Traditional Chinese Medicine, to Traditional and Complementary Integrated Medicine. So this is for a really specific purpose, and it's because they want to work this into healthcare systems around the world, and changing it to this name actually makes it be a lot more just easier to, what's the word I'm looking for? I can't think of the word, but easier to mix in with the other healing systems, medicine of the world. So the WHO, World Health Organization, changed the name of TCM to Traditional and Complementary Integrated Medicine. All right, so the next thing that's happening is the ICD codes, which are the codes that you use to bill insurance. So it's really exciting, but they're making Chinese medicine codes. So there's going to be codes like dampness and heat and wind, and basically our language, it's our diagnostic language. And so that means that when we code like that, those of us that are fully trained are going to be able to understand how to use these codes. So this could be really good for acupuncturists, because as you know, a lot of doctors are really trying to take our medicine now. We have MDs, we have PTs, we have, everybody trying to take over our medicine. So just making sure you guys aren't commenting. Swipe left to reveal comments. Okay. So it's really good if we have insurance diagnostic codes that only we understand, because that will require someone who's fully trained in acupuncture to use those codes, versus the doctors or the chiros or the PTs that just get these 200-300 hour courses and then all of a sudden they're acupuncturing patients. That's not good. So this is really a shift towards acknowledging acupuncturists and the training that we're doing. So that's really, really, really exciting. So that is the first big change that's coming up in Chinese medicine. Change number 2. All right, the change number 2 that has happened in this last month has to do with the opioid crisis. So the opioid crisis does not only include like street drugs, but it also includes pharmaceuticals, because pain meds are so overprescribed. It's crazy. I remember when I was in the hospital, how many years ago now? 16 years ago? 15 years ago with my open heart surgery. For those of you that don't know, I had open heart surgery when I was 23 years old. And it was such an eye-opening experience to Western medicine that's actually what led me to study Eastern medicine. Because I just knew that there had to be more to healing than what I experienced. So when I was in the hospital for that, I remember that I woke up from my open heart surgery and literally the room was spinning. Spinning. Like I've never seen or experienced anything in my life like that since or before that. And way back in my early 20s, I used to party hard, like drinking and drugs and all that horrible stuff. But but I never experienced that. The only time I ever experienced that was when I woke up from open heart surgery and the room was crazy spinning, and my surgeon was there, and I told him what was happening. He's like, oh yeah, we probably just over medicated you. And I was like, what? Like, you're just gonna blow it off like that? Like, that's okay? No. So as I stayed in the hospital that week to recover from the surgery, they kept pumping my IV full of pain meds and narcotics. And I really wasn't actually in too much pain after surgery. I had a lot of back pain, but my chest really wasn't painful at all, regardless of the fact that they had sawed it open and sewn my sternum back together, not to mention my flesh. Sorry for those of you sensitive out there, but that actually wasn't really a lot of pain. What was painful was my back. However, the narcotics made me feel so sick that I asked them not to give them to me. However, they continued to pump them into my IV, even against my will. So the opioid crisis is a real thing. I've experienced it. It's happening everywhere. And one of the groups that really gets hit hard by this are the veterans. The veterans experience so much pain and post-traumatic stress, and Western medicine really doesn't know what to do with these guys. So they just pump them full of pain meds. And it's causing a national emergency. President Trump has actually even stated that it's a national emergency, and there are a lot of lost lives, and it's costing government billions of dollars. So what has recently happened with change number 2 is that the Veterans Choice Program has begun to authorize acupuncture treatments, lots of them, for acupuncturists outside of the VA. So you don't have to be working in the VA anymore in order to be able to treat veterans with acupuncture. Amazing, amazing. Our medicine works so well with the veterans, with their pain, with their PTSD, their insomnia, their anxiety, you know, everything and anything that these poor guys have. So, and women, not just guys. So what you want to do in order to be included in this is that you need to register with one of these 2 companies, and it'll depend upon which coast you're on, West or East Coast. So if you're on the West Coast, you're going to register with TriWest. It's not TRICARE, it's TriWest. And then if you're on the East Coast, you're going to register with HealthNet. So how you're going to register with these is you're just going to go on Google, and you're going to either look up TriWest if you're on the West Coast, or HealthNet if you're on the East Coast. You're going to go, let's say, TriWest VA provider. So Google that, and then you're going to register on their website. This doesn't make you an in-network provider. That's different. They just need you to register in order to be able to you to be allowed to take the veterans insurance to pay for their treatments. So, you know, sometimes they're allowing 6 to 8 visits, sometimes they're allowing a lot more. We're really not clear yet on how many, but they are usually allowing at least 6 to 8, you know, which is at least 1 round of acupuncture for these veterans, which is amazing because the VA here in LA, you know, there's a huge one right down the street. And I remember years ago, I got in contact with the acupuncture clinic there, because there is a clinic there. However, in the VA, only acupuncturists / MDs can treat veterans. And so an acupuncturist who wants to go work there can't go treat the veterans. So it's really sad, because I was talking to the acupuncturist MD, the only one that they had there, and he said that the waiting list was like 4 months long. So these guys would come in and get 1 treatment, and then they wouldn't get another treatment for like 4 months. So, you know, any time that you can give a full session of treatments to a veteran is amazing. And yeah, Barbie, yeah, you say that's amazing. Exactly what I just said. Yeah. So it's happening now. So the word on the street is that the reimbursement rate is really good also, because the whole point in doing this is not to be doing this for peanuts, you know, because yeah, we want to help as many people as we can, but first you got to help yourself, guys. And if you don't help yourself financially, you know, it's really hard to help other people. So, however, the reimbursement rates, so from what we're hearing, The 99200 exam code they're paying, and they're paying about $120 for that. And then the acupuncture codes, they're paying between $35 and $45 a set. So you're going to get back at least your cash price from these insurances for the veterans, which is really awesome. I've had some people on the East Coast tell me that they're having a hard time getting reimbursed from the Health Net, but I'm hoping with these shifts that we're seeing right now, that it's going to start to get easier and easier. And I always encourage every acupuncturist to use an insurance biller when you do any type of insurance stuff, even with this veteran stuff, because we're not trained in insurance billing, and we need to focus all of our energy on our practices and healing our patients and getting patients in our practice. So, after you register with either TriWest or HealthNet, what you want to do is tell every single patient that you have that you're now registered and able to take the veterans health insurance for payments, because everybody knows veterans. Everybody. So you just want to start to put the word out there. You know, you can hang up a sign in your office. You can hang up signs in community centers. This is how you want to get the word out there that you are now registered and accepting veterans health insurance. Anybody have any questions on that? Let me know. Oops. There we go. All right. So that's really the exciting change number 2. All right. Exciting change number 3 is huge. This is huge. It's such an exciting time right now to be an acupuncturist. I mean, it's amazing what's happening. So, all right, our third change is that the FDA is now, oh, wait a minute. Georgia's asking, what was that exam code? Georgia, the exam code that I heard, because basically I heard this, if you didn't see the beginning, from a webinar from Marilyn Allen and Sam Collins. I've also spoken to Marilyn Allen about all this. But they said that the exam code that most acupuncturists bill is 99203. 99203. And that's the one that people are getting reimbursed around 124. You know, and don't be afraid to bill exam codes. I would recommend, if it comes around again, it might be happening now, but take the American Acupuncture Council Advanced Insurance Seminar. It was really helpful for me because it breaks down all the exam codes and how many bullets that you need to show in your charting in order to use that exam code. So when you do your, always bill exam codes. Don't be afraid of them. You just have to make sure that your charts are really thorough if you ever get asked for your chart notes. All right. I still am glowing in this light. All right, thanks. You had to turn the sound off. Client came in. We'll check back later. Okay, Georgia. Heal the world, babe. All right. Change number 3, really exciting change in the acupuncture world, is the FDA is now requiring, maybe I'll turn on my light here. Hey. That's a little better. All right, anyway. Okay, guys, the FDA is now requiring in medical school that alternatives to pain medicine needs to be taught to medical doctors. This is amazing. And this is the FDA. The FDA is telling medical schools that they must learn alternatives to pain meds. These alternatives also include acupuncture. They're also now going to be required to tell their patients alternatives to medicines, including acupuncture. That's amazing, okay? That's part 1 of the third change. Part 2 is that the state attorney generals, these are the guys that control the state laws, they're a national association. They told the insurance companies, the huge insurance companies that we all go through, Blue Shield, Aetna, Blue Cross, whatever, all of them, they told them that acupuncture, physical therapy, chiropractics, and massage now need to be included more on policies and have less limited access, which means there needs to be more treatments available. So these are two huge government agencies stepping up and telling insurances and medical schools what to do. The third government agency that has stepped up is the Joint Commissions. So the Joint Commission is a commission that accredits hospitals every 2 years in order to get federal funding for the hospital. So basically every hospital has federal funding, and that's how they stay open. So hospitals must be accredited by the Joint Commission. So what the Joint Commission has done is they are requiring by January 1st, 2018, that hospitals must include alternative care, and this alternative care includes acupuncture. Yeah, it includes acupuncture. So this is mind-blowing. This is amazing. So basically, a government system or agency has said that acupuncture must be included in hospitals as of January 1st, 2018, in order to be reaccredited past that date. This is real. This is real. Changes are happening really fast. It is mega exciting. So a few things coming up. What we don't really know yet is who's going to administer the acupuncture in the hospitals. You know, are they going to train all the doctors? Or are they going to hire acupuncturists in? There are about 6,000 hospitals in the United States, so there's a really good chance that they're going to use acupuncturists. Also, because the ICD-9 or ICD codes, I think it's going to be ICD-11, when they're coming out with the Chinese medicine diagnostics, and so only really fully trained acupuncturists can understand those diagnostic codes. So it's a really good chance that there's just going to be a lot of acupuncturists in the hospitals. So after I announced this yesterday, I actually had 2 different acupuncturists write to me. One of them was in New York, and she said, no wonder I saw a huge hospital here in New York hiring acupuncturists when she's never seen them doing it before. And then someone else wrote to me and said that there was a hospital in Wisconsin also hiring acupuncturists right now. This is happening. This is happening. So, the thing is, are we prepared to step up like this? It's now more important than ever to really confidently speak about your medicine, to confidently explain things to your patients, to really just own your medicine, because we don't want to lose control of it to the hands of other doctors, especially at this point. We're in a huge, amazing transition right now. I mean, amazing. We are the pioneers of mainstream modern acupuncture, like literally. So we need to get our shit together so we don't lose control of our medicine, and that means that we need to take these jobs in hospitals. We need to spread the word to our patients that other doctors are only going through a few 100-hour courses, and you really need a fully trained acupuncturist. We need to, like I said, speak confidently about the medicine. We need to be able to, if you are working in hospitals, confidently speak with Western doctors. I do know a few acupuncturists already working in hospitals, and they have said that, the Western doctors don't give them a break. They want you to know all their lingo and meds and this and that. So this, like I said, we are the pioneers, we are the innovators. We need to just get in there, take action, do the best that we can, and be the best doctors that we can. The thing is, acupuncture works. Acupuncture works amazing. I don't know if you saw my post earlier today, but earlier in the year I went to Kenya and I integrated acupuncture into a hospital there, and I was working side by side with Western doctors, and I was floored by the power of the two medicines working together and how just well it worked for the patients and their healing so fast. It was amazing. So when we're stepping into these new environments and acupuncture is welcome to hospitals and this and that, then you need to be confident that this is going to work. I have zero doubt. I have zero doubt that this is going to work, because our medicine is amazing. It's amazing. It blows my mind. You just have to make sure that you get the points in your patient in the correct treatment plan in the correct amount of time. The exact points. Don't overthink it. Don't overworry it. The body knows how to heal itself. It just needs to be jump-started by the acupuncture. So, anyway, these are 3 huge changes in the Eastern medicine acupuncture world. The World Health Organization, the veterans, the FDA, the state attorney generals, and the Joint Commission. So federal agencies have overstepped pharmaceutical industries to take control of bringing Eastern medicine to the people. And that is so exciting. So if anybody has any questions about this, pop them up now, because that is the announcement. So I want you to keep an eye out for hospitals hiring, spread the word to other acupuncturists, and sign up for the veterans for the Tri-West or HealthNet. And, you know, just be super proud and excited to be an acupuncturist, because we are pioneering and mainstreaming Eastern medicine. All right, keep healing the world. I love you.